Hello students, greeting of the day. Myself Srimati Gitanjali Mahapatra, lecturer in zoology, both Panchayat College both. Today I will discuss about the chromosomal and Mendelian disorders. First come to chromosomal disorders. A chromosomal disorder occurs when there is a change in the number or structure of the chromosomes. The change in the amount or arrangement of genes and chromosomes in cells may result problems in growth, development and functioning of the body systems. In this animation, you can see the chromosomes. The chromosomes are generally present within the nucleus of the cell. The chromosomes are generally present in the form of pairs. Out of the pair, one has come from the father, another has come from the mother. Studying of human chromosomes. First come to clinical cytogenetics. Clinical cytogenetics is the study of the relationship of chromosomal alterations in genetic diseases in human beings. Next come to karyotype. What is karyotype? Karyotype is an individual's chromosomal constitution, that is 46 in case of male and 46 in case of female. In case of males, the chromosomes are of 44 autosomes plus X and Y chromosome. These X and Y chromosomes are called sex chromosomes. But in case of female, the karyotype is 44A plus XX. Both the sex chromosomes are similar. They are named as X and X. The chromosomes are identified by their size, position of the centromere and their bending pattern. Here in this diagram, you can see the 23 pairs of chromosomes in case of male. In this case, here the two sex chromosomes are different from each other. One is X, another one is Y. Next come to normal human karyotype. In case of a normal human being, there are 23 pairs of chromosomes. Out of the 23 pairs, 22 pairs are called autosomes. They are numbered as from 1 to 22. Then last come to the sex chromosome. The sex chromosomes are different from each other in males and females. In case of female, the two sex chromosomes are not known as X chromosomes. They are similar to each other. But in case of male, the two sex chromosomes are different from each other. One is larger in size, that is called X chromosome. Another one is smaller in size, that is called Y chromosome. The chromosomal disorders in humans. There are mainly three types of disorders found in case of human. First one is known as Down syndrome. Second one is Turner syndrome. Third one is Klinefelter syndromes. We will discuss one by one. First come to Down syndrome. Down syndrome is a genetic disorder caused when abnormal cell division results in an extra copy of chromosome 21. Chromosome 21 consists of two chromosomes. Instead of two, there are three chromosomes are present in the 21. It was first reported by British physician Langdon Down in 1866. This is also called trisomy 21. This is caused due to the non-disjunction of chromosomes of pair 21 during meiosis, as both the chromosomes of pair 21 pass to a single ovum during gamete formation. In case of female, the two 21 chromosomes are going to one egg. In another female gamete does not contain any 21 chromosome. The ovum contains 24 chromosomes instead of 23. Not generally, ovums are containing 23 chromosomes, half of the normal chromosomal set, that is 46. Instead of 23 chromosomes, the ovum containing 24 chromosomes, when fertilizes with the sperm, the 21 set will contain 3 chromosomes instead of 2. This would result Down syndrome. Offspring have generally 47 chromosomes in this syndrome, out of which in case of if the offspring is male, then the chromosome is 45 number of autosomes plus XY, and if the organism, the baby is female, in that case the autosomes are of about 45 and there are 2 X chromosomes present in case of female. The 21 number chromosome is 3 in number. In this diagram you can see all the chromosomes are normal from 1 to 20. The 21 set, it contains 3 chromosomes instead of 2. The normal set containing 2 chromosomes, but here the 21 set contains 3 chromosomes. Next, this is the disjunction, non-disjunction process, during which the 2 chromosomes are going to one pole, both are going to one pole. So, When the 21 said chromosome going to one pole during oogenesis, this results in the formation of the ovum which contains 24 chromosomes. Next come to the symptoms of the Down syndrome. These are the following symptoms which are found in Down syndrome. First, the flattened face, next small head, next short neck, then protruding tongue, upward slanting eyelids, that is called palpebral fissures, unusually shaped or small sized ears, poor muscle tone, broad short hands with a single crease in the palm, relatively short fingers. They have small hands and feet. They have excessive flexibility, teeny white spots on the colored part of the eye, that is called iris. This condition is called brush field spots. Short height, these organisms are having generally short height. These are the different characters found in the diagrammatic view. In this case, you can see the organisms, the individuals are having Down syndrome. This is the character which contains the white spots in the eye. These are the low placed ears, small size ears. This is the gap is found between the two fingers. The small crease is present in the palm. This type of tongue is found. This is the tongue found in case of adults. These are the upward slanting eyes. This is the one crease. This is the child having Down syndrome. And the chromosome number 21 is 3 in number. You can see in this diagram. Next come to the diagnosis. A doctor may suspect Down syndrome in a newborn based on the baby's appearance. That can be confirmed by a blood test. That test is known as karyotype test. That lines up the chromosomes and will show if there is an extra chromosome 21 or not. Other kinds of tests can diagnose Down syndrome before your baby is born by checking a sample of their DNA for an extra chromosome 21. In case of Down chromosome, there are 321 chromosomes are present. So, these are the following tests which are done in case of baby when it is present in the womb of the or uterus of the mother. The first test is known as chorionic villus sampling. This can be done during the first trimester. Generally, the pregnancy of a woman consists of 3 trimesters. First 3 months is called first trimester. Second 3 months, that is 3 to 6, is called second trimester. And third 3 months, that is from 6th to 9th, that is known as third trimester. The 3 trimester, first trimester, this test is done during the first trimester using cells taken from the placenta. This test is called chorionic villus sampling. Second test is known as amniocentesis. Amniocentesis means when the amniotic fluid is taken from the amniotic sac surrounding the baby, that is during the second trimester. This is known as amniocentesis. By testing the fluid, the doctor can know about the presence of Down syndrome. Next come to percutaneous umbilical cord blood sampling. This is also done in the second trimester during using blood removed from the umbilical cord. This is the umbilical cord. When the blood is removed from the umbilical cord and tested, then Down syndrome can be detected. In the previous diagram, you can also see the different tests. First one is this is the chorionic villus sampling. The second one is known as amniocentesis. Then the third one is called percutaneous umbilical blood sampling, that is known as PUPS. These 3 tests are done to detect Down syndrome in human being. Next come to the treatment. There is no specific treatment for Down syndrome, but there is a wide range of physical and developmental therapies designed to help people with Down syndrome to reach their full potential. Each child will have different needs. Yours may benefit from first one, the physical, occupational, speech therapy. Next, specialized education services. Then, social and recreation activities. Next, come to programs that offer job training and teach self-care skills. These skills are done to improve in the condition of Down syndrome. Next, come to Turner syndrome. Turner syndrome is a genetic condition caused by the abnormality of one of your sex chromosome. It is also called monosomy X, gonadal dysgenesis, and Bonnevie-Ulrich syndrome. Only the female sex develops this condition. Henry S. Turner first described this genetic disorder in 1938. It affects only females. Results when one of the X chromosomes is missing or partially missing. Females have generally two X chromosomes instead of two. If one X chromosome is present, then the Turner syndrome is found. Turner syndrome may be diagnosed before birth. Before birth means that condition is known as prenatal condition, or during infancy or in early childhood. The persons having Turner syndrome, this is also mainly found in females. Females having Turner syndrome have 45 number of chromosomes instead of 46. They have 44 autosomes and 1 X chromosome. Next come to the diagrammatic view of the Turner syndrome. In this case, the female has 22 pairs of autosomes which are normal, but the one pair of sex chromosome, in this case only one X chromosome is present, another chromosome X chromosome is lost. This condition creates Turner syndrome. Next come to symptoms of Turner syndrome. Signs and symptoms of Turner syndrome may vary among girls and women with this disorder. Prenatal cell-free DNA screening done by screening blood sample from the mother, or prenatal ultrasound. Prenatal ultrasound of a baby with Turner syndrome may show heart abnormalities and abnormal kidneys. In this diagram, you can see the girl having Turner syndrome. It has low posterior hairline, waved neck and extra skin in the neck, wide set nipples. Nipples are very widely spaced. Discolored spots on skins. These spots are found on the skin, and swollen feet. And swollen hands. These are the characters of the symptoms of the Turner syndrome. The symptoms which are found at birth or during infancy. The symptoms are wide or wave-like neck, low set ears, broad chest with widely spaced nipples, high narrow roof of the mouth, arms that turn outward at the elbows, fingernails and toenails that are narrow and turn upward, swelling of the hands and feet, especially at birth, slightly smaller than average height at birth, slowed growth, cardiac defects, low hairline at the back of the head, receding or small lower jaw, short fingers and toes. These symptoms or these characters are found at birth or during pregnancy. Next come to the symptoms which are found in childhood, teenage and adulthood. In that case, they have slowed growth, no growth spots at expected time in childhood, adult height significantly less than might be expected for a female member of the family, failure to begin sexual changes expected during puberty, sexual development that starts during teenage years, early end to menstrual cycles not due to pregnancy. For most women with Turner syndrome, inability to conceive a child without fertility treatment. In this diagram, you can see the females having Turner syndrome. These are the symptoms which are found in this syndrome. Next come to diagnosis. This can be diagnosed by blood test to check the sex hormone levels. Then next the echocardiogram to examine for heart defects. Next the pelvic exam. Next the pelvic and kidney ultrasound. Next chest MRI. These tests are done to diagnose the Turner syndrome. In this diagram, you can see the doctor is examining the patient having Turner syndrome. This is the echocardiogram to examine the heart defects. This is the pelvic part examination. This is the chest MRI. These tests are done to diagnose the Turner syndrome. Next come to treatment. There is no cure for Turner syndrome, but therapies have been developed that can improve physical development. The primary therapies for affected individuals are growth hormone therapy and estrogen therapy. What is growth hormone therapy? Growth hormone therapy usually given daily age injections of recombinant human growth hormone It's recommended to increase the height as much as possible at appropriate times during early childhood until the early teen years. The growth hormone, which are artificially prepared by recombinant DNA technology, are injected into the body of the patient having Turner syndrome. Body of the person having Turner syndrome during the early childhood until the early teen years. Next come to estrogen therapy. Estrogen therapy started around the age of 11 or 12 years. Estrogen helps to promote breast development and improve the size of the uterus. Estrogen helps with bone mineralization and when used with growth hormone may also help with height. Next come to Klinefelter syndrome. It is a genetic condition that results when a boy is born with an extra copy of X chromosome. Generally boys have one X chromosome and another Y chromosome. When instead of XY, the sex chromosomes are XX and Y. That condition leads to Klinefelter syndrome. The karyotype of that male is 44 autosomes and XXY. Klinefelter syndrome is a genetic condition affecting the males. Older women having a slightly higher chance of having a baby. They are having the babies may be having XXY syndrome or Klinefelter syndrome. But the chance is small. When the baby having Klinefelter syndrome, he has karyotype having 44 autosomes and XXY sex chromosomes. Generally, this type of babies are born from older women. This is the diagrammatic view of the Klinefelter syndrome. In this diagram, you can see the 22 pairs of autosomes are normal, but the sex chromosome in case of male, that is X, X and Y. Normal males have X and Y, but in this case, there are two X chromosomes are present in case of males. Next come to the symptoms of the Klinefelter syndrome. The symptoms which are found in boys and teenagers, those are as follows. First, they are taller than average stature, longer legs, shorter torso, broader hips compared with other batch, absent, delayed or incomplete puberty. After puberty, less muscle and less facial and body hair compared with other teens. Small firm testicles, small penis, enlarged breast tissue, weak bones, low energy levels, tendency to be shy and sensitive, difficulty expressing thoughts and feeling or socializing, problems with reading, writing, spelling and mathematics. Generally the boys having the female characters in this case. If they develop breast, that condition is known as gynecomastia. The boys are generally developing female characters due to the presence of two X chromosomes in their body. Then the symptoms which are found in case of men. Signs and symptoms may include low sperm count or no sperm, small testicles and penis, low sex drive, taller than average height, they have weak bones, decreased facial and body hair, less muscular as compared with other men, enlarged breast tissue, increased belly fat. These symptoms are found in case of men having Klinefelter syndrome. You can see in this diagram, this is the frontal baldness is absent. This person is like the female. They have tendency to grow fewer chest hair. They have generally less or no chest hair. The breast is developed slightly. The female type of pubic hair pattern is found. The testes and penis are smaller in size. They have long arms and legs. And arms are generally longer. They have wide hips like the females. They have narrow shoulder. The shoulder is narrow in case of females, but here the males have narrow shoulders. They have poor beard growth. These characters are found in case of men having Klinefelter syndrome. Next come to diagnosis. First, chromosomal analysis or chromosome analysis. This is also called karyotype analysis. Here the blood test is done to look at your chromosomes. The person having Klinefelter syndrome, if the blood is tested, then the chromosomes are tested, where you can see the chromosome. There are two X chromosomes instead of one X in case of males. Next come to hormone test. This check hormones levels in the blood or urine. Blood or urine is collected. Then by checking the hormone level, a doctor can diagnose the presence of the Klinefelter syndrome. Next come to semen analysis. Semen analysis is done to see the sperm count. If the quantity of sperm is less, then the it can be detected that the person may be suffering from Klinefelter syndrome. So this is the karyotyping test, then this is the hormonal test, and this is the semen analysis. You can see in this diagram. Next come to the treatment. Treatment includes testosterone replacement therapy throughout your life that can help prevent some of the long-term problems that come with Klinefelter syndrome. Generally, persons having Klinefelter syndrome have low testosterone level. If the testosterone is injected into the body by different methods, then the person can develop some male characters properly. Other treatments include counseling and support for mental health issues, fertility treatment. In some cases, the person's sperm is collected and artificially fertilized to form the zygote. Then zygote can develop into a child. This method is known as artificial method. Then next to come to occupational therapy or physical therapy to help with coordination and build muscles. Then plastic surgeries can be done to reduce the breast size, speech therapy for children, support in school to help with social skills and learning delays. This can be done to treat the person suffering from Klinefelter syndrome. In this diagram, you can see the teacher is guiding the child. Here also the teacher is guiding the child having Klinefelter syndrome. Next come to the Mendelian disorder. What is Mendelian disorder? The disorder which follows the laws of Mendel, that is known as Mendelian disorder. This example of this disorder is thalassemia. In this case, thalassemia is an inherited blood disorder in which the body makes an abnormal form of hemoglobin. Hemoglobin is a protein that is present in the RBC or red blood cells. The hemoglobin carries the oxygen to each and every cell of our body. This disorder results in excessive destruction of RBC, which leads to anemia. Anemia is a condition in which your body does not have enough normal healthy RBC. If the RBC level is low, then oxygen transport capacity is also low. The thalassemia disease that is inherited, meaning that at least one of your parents must be a carrier of the disorder. If the gene is present in the child, the genes generally come from the parents. So the genes must come from the parents. In this diagram, you can see the parents are carriers. They are containing one gene. This parent contains one gene. This parent contains one gene. If the two genes are coming to a single child, in that case, the child will become thalassemic. If the dominant genes are coming to the child, then the child will become totally normal. If one dominant gene and one recessive gene are coming from two parents, in that case, they are known as the carriers. Next come to the diagrammatic view of the thalassemia. In case of thalassemia, in the normal case, the RBC are normal. But in case of thalassemia, the RBC will become abnormal. Next come to the symptoms of thalassemia. Generally, they have bone deformities, especially in the face region. They produce dark urine. They have delayed growth and development. They have excessive tiredness and fatigue, yellow or pale skin, because the hemoglobin concentration is very less in thalassemia. So hemoglobin is a protein which is made up of alpha chains and beta chains. In this diagram, you can see the hemoglobin structure of hemoglobin. This is the normal hemoglobin which contains two alpha chains and two beta chains containing sufficient amount of iron. But it is the hemoglobin of thalassemia patient which is affected by beta thalassemia. In that case, the chains are not normal. They are containing less amount of hemoglobin. There are two types of thalassemia. There are two main types of thalassemia, alpha thalassemia and beta thalassemia. The hemoglobin of a healthy person contains two pairs of globins. One pair alpha globins containing alpha chains and one pair beta globins containing beta chains. Alpha thalassemia occurs when a gene related to alpha chain is missing or mutated. Beta thalassemia occurs when the similar gene defects affect production of beta chain. When the beta chains are not normally produced, in that case the beta thalassemia occurs. Both alpha and beta thalassemia include the following two forms. They have thalassemia major and thalassemia minor. If the two defective genes are present, then that is known as thalassemia major. If one defective gene is present, another gene is normal. In that case, that is called thalassemia minor. First come to beta thalassemia. If a person inherits one defective gene for beta chain, his or she is said to have beta thalassemia minor, which is not severe. If two defective genes are present, inherited one from each parent, the result is much more severe, called beta thalassemia major. That is also called Cooley's anemia. In that case, both the beta genes are defective in the organism. That is called beta thalassemia major. Next come to alpha thalassemia. Alpha thalassemia is much less common than beta type, where defects are found in alpha genes. All the types and subtypes vary in symptoms and severity. The onset may also vary slightly. Here in this diagram you can see the genes for beta chains. If the genes are normal, the beta chains will become normal. But when the genes are present in the alpha chains, the genes for alpha chains are present here. If the genes are normal, then they produce normal alpha chains. Then that will result the formation of normal hemoglobin. The gene for beta chains are present in the chromosome number 11, and the genes for alpha chains are present in the chromosome number 16 of the human being. Now come to this is the diagrammatic view of the RBC which are found in the normal case. Then here you can see the two parents. The two parents are carriers. When the children are carrying, the carrier means they contain one normal gene and one thalassemic gene. The mother also contains one normal gene and one thalassemic gene. In that case, if the normal both of them provide normal genes to the child, in that case the child will become normal. If one provides normal gene, another provides thalassemic gene, in that case this child will become carrier. This child also carrier. If both the parents provide thalassemic gene to the baby, in that case the baby will become thalassemic. This follows the Mendel's law. So this is a Mendelian disorder. Then come to diagnosis of thalassemia. Abnormally shaped red blood cells is a sign of thalassemia. When the shape of the RBC are defective, in that case that is called thalassemia. The lab technician may also perform a test known as hemoglobin electrophoresis. This test separates out the different molecules in the red blood cells, allowing them to identify the abnormal type. When the hemoglobin electrophoresis is done, the abnormal cells can be identified. So the thalassemia can be detected by this method. In this diagram, you can see the hemoglobin electrophoresis, how the molecules are moving from the one anode to cathode. Second test, depending on the type and severity of thalassemia, a physical examination might also help your doctor to make a diagnosis. For example, a severely enlarged spleen might suggest to know about thalassemia. Next come to the treatment of thalassemia. Treatment can be done by the blood transfusion. Second, by bone marrow transplant. Third, by the medications and supplements. Fourth, possible surgery to remove the spleen or gallbladder. These are the treatments which are done in thalassemia. In this first diagram, you can see this is the long bone, thigh bone. This is the thigh bone. The thigh bone, in the center of the thigh bone, the bone marrow is present. This is the bone marrow. The bone marrow is transplanted during the thalassemia case. In the second diagram, you can see the blood groups. There are 4 types of blood group: O, A, B and AB. O blood group, the person having O blood group can give blood to all the blood groups. But the person having A blood group can give blood to A or AB. The person having B blood group can give blood to B or AB. But the person having AB blood group can give only blood to AB blood group. So in this case, O can give blood to all. So this is known as the universal donor. But group AB can donate to other ABs but can receive from all others. Then that is known as universal receivers. AB can give to AB but AB can receive from all. This is known as universal receiver. Then to give awareness about thalassemia, the World Thalassemia Day is observed on 8th May every year. This is called WHO World Thalassemia Day. Thank you.